A graft may be harvested from the patient through a separate incision. A cast or splint may be applied. Repair of ruptured musculotendinous cuff, e.g., rotator cuff, open, acute, chronic. A longitudinal incision is made along the anterior portion of the shoulder and the skin is reflected. The deltoid fibers and the underlying tissues are divided. The coracoacromial ligament is divided and the supraspinatus tendon is detached by a transverse incision along the greater tuberosity. The distal frayed edges of the tendon are removed. A trench is chiseled into the humeral bone along the level of the anatomical neck of the humerus. The supraspinatus tendon flap is buried in it. The flap is fixed with sutures tied to the tendon and passed through holes drilled in the bone. The repair is completed with side-to-side sutures of the supraspinatus to the adjacent subscapularis and infraspinatus tendons. The incision is closed and a soft dressing is applied. Repair of defect with autograft, radius or ulna. Radius and ulna. The physician makes a longitudinal incision along the forearm. An anterior approach is made for the radius, medial for the ulna, or two incision for both. The defect is exposed through dissection. To harvest the bone graft, the physician makes a separate incision over the iliac crest. Bone from the upper tibia may also be used. The bone is exposed, and the physician uses an osteotome to harvest strips of bone. These bone strips are used to fill the defect. A screw or wire wrapped around the defect holds the bone graft in place. The incision is repaired in layers with sutures, staples, and slash or strie strips. However, the deep facial layer is not closed because of the potential to develop compartment syndrome. Repair and reconstruction, finger, volar plate, interphalangeal joint. The physician incises the overlying the skin and dissects to the IP joint. The plate of the joint is sutured to the proximal and distal bones to stabilize the joint. The incision is sutured in layers. Repair of syndactyly, web finger, each web space, with skin flaps. With skin flaps and grafts. Complex, e.g., involving bone, nails. The physician incises the skin of the web for digital release and the underlying tissues are freed. Repair macrodactylia, each digit. The physician incises and retracts the skin to expose the underlying tissue. Reduction is accomplished by removing excess connective tissue and bone if necessary. The tissues are reanastomosed and secured with sutures. The incisions are sutured in layers. Repair, intrinsic muscles of hand, each muscle. The physician incises the overlying skin and dissects to the damaged muscle. The integrity of the tendons and muscles are tested. Defects are corrected to restore function. The incision is sutured in layers. When reporting this procedure, indicate which intrinsic muscle was repaired, interossei or lumbricals.